By opening the space, we aim to highlight how faith, cultural values, and healthcare awareness can come together to build trust, promote safe practices, and strengthen the well being of all communities. We are deeply honored to be joined by some of the most inspiring voices today, individuals who have dedicated their lives to community service, social harmony, and inclusive progress. Their work reminds us that meaningful change starts with listening, learning, and working together with respect and sincerity. As a Chief Secretary of Quackery and Malpractice Committee, I thank you for being here and for engaging in this important dialogue. We hope the conversation today will inspire deeper awareness and stronger collaboration as we work towards a healthier, safer, and more informed society. With that, I would like to invite someone whose leadership and dedication continue to inspire youth led efforts across our platform, the Vice President of Pakistan Health Parliament, K chapter, to kindly share a few opening words and introduce the mission of Pakistan Health Parliament.
Assalamualaikum everyone. I hope that you all are doing well. Thank you for joining us on this powerful and much needed session. As the Vice President of K chapter, Pakistan Health Parliament's K chapter, it's and warmly welcome our esteemed guests for firstly and most importantly taking their time out with us today. And also for all the attendees for showing up and standing with us in this important cause. Pakistan Health Parliament's main vision has always been to address health related issues and to raise awareness. So, most importantly, a special appreciation to our incredible Chief Secretary Yushe and her team for making this session possible through their vision and dedication. So, without any further delay, Yushe, I would request you to get this session started.
Thank you so much, Itruba, for that thoughtful message and for your kind words. Your words beautifully capture the heart of what Pakistan Health Parliament stands for. Now, I have the great honor of introducing the exceptional individuals who will be serving as speakers for today's webinar. Each one of them brings a unique perspective and an unwavering dedication to public service. Their presence with us today is both a privilege and and a powerful reminder of how inclusive representation can pave the way for collective progress. Our first speaker is Reverend Dr. Shajid Zafar Gori. Rev. Dr. Gori is a remarkable figure whose contributions span across medicine, faith, and law. He is a veterinary doctor, an ordained pastor, and an advocate of High Court. Currently serving as Patron in Chief of Christians Law Association of Pakistan, he has worked tirelessly to support religious minorities through legal aid, communication outreach, and awareness building. His multidimensional background allows him to approach issues like malpractice and misinformation with both scientific and spiritual sensitivity, a rare and powerful combination. Our second speaker is Mr. Arun Kumar. Mr. Arun Kumar is a passionate human rights advocate and the provisional coordinator for the Pakistan Hindu Council. With a background in English literature and law, he has long championed minority rights, interfaith harmony, and democratic values. Mr. Arun has represented marginalized voices through national and international media and has served on key bodies, including the Prime Minister's Task Force on Hindu and Sikh properties. Currently, he also teaches law at at the Police Training College, Lahore, helping shape future law enforcers with a right-based perspective. Our final speaker is Dr. Ajay Saran Singh. Dr. Ajay Saran Singh is a dedicated dental surgeon and the president of PTI Minority Wing for Malakand region. As a son of late Dr. Saran Singh, he carries forward a legacy of service, compassion, and community leadership. Alongside his medical profession, Dr. Singh actively advocates for minority rights, interfaith harmony, and better healthcare access in underserved areas of Khyber Pakhtunkhwa. His work reflects a strong commitment to justice, inclusion, and empowering marginalized communities through both political and social platforms. We are truly honored to have all three of you with us this evening. Your presence, your experience, and your continued efforts serve as a powerful testament to the strength of inclusion, advocacy, ethical leadership. Before we begin, I would like to share that Mr. Ajay Singh will be joining us a little later due to internet issues. We are grateful for his participation and look forward to hearing from him as soon as he joins. With that, we now move to the most awaited part of our event, the interactive session. Let's begin the conversation. I kindly request the speakers to turn on their cameras. My first question is for Mr. Shazil Zafar Gori. Mr. Zafar, can you hear us?
I can hear you.
Okay, okay. मिस्टर सफर, आपने कभी ऑब्जर्व किया है कि आपके सराउंडिंग्स में जो माइनॉरिटी कम्युनिटीज हैं वो मेडिकल माल प्रैक्टिस या क्वैकरी का शिकार हो रही हो ड्यू टू लैक ऑफ अवेयरनेस और सपोर्ट एंड आपके ख्याल से कम्युनिटी लेवल पर कौन सी ऐसी एफर्ट्स करनी चाहिए विच कुड हेल्प रिड्यूस रिस्क एंड इम्प्रूव हेल्थ केयर एक्सेस फॉर दीज ग्रुप्स?
Ji, thank you so much. First of all, I'm very thankful to Pakistan Health Parliament, K chapter, that they have provided me with an opportunity to speak out on this important issue. I'm very thankful to all of you to come with your question. Uh, Before I answer this question, I want to make one thing very clear that the area that I am living in, luckily I am living in an urban area, but as we are talking with special reference to the marginalized community, that is Christian community, one of the minorities in these countries. So most of the Christian people, they live in remote and peripheral area. But luckily, we are living in an urban area. But while talking about this area, before I begin my question, I want to tell something about the background of this situation, because every situation arises out of certain reasons. Uh, as a matter of fact, we have, without taking any name, we have two hospitals which are nearby our area, two main hospitals. There are many hospitals, but they are very far away. But the nearest two hospitals, one belong to the public sector and the other belong to the private sector. Now, beginning with the public sector hospital, that is overburdened, and there are limited number of doctors, there are limited number of staff, limited number of beds. So this hospital is visited by hundreds and hundreds of people, patients on daily basis. And so it's very hard to for anybody to get his or her turn for medical checkup for ordinary persons. So what to talk about some marginalized communities who don't have any approach or other resources to reach out such kind of facilities. Secondly, most of the time the medical equipments, they are out of order, the drugs are out of stock, or the stock, even the stock that is supplied by the government, that stock unluckily is mostly found to be sold out on the pharmacies nearby the hospitals. So it's very hard for the ordinary patients to get their turn for medical checkup or to get medicine from these hospitals, and consequently they are deprived of standard medical facilities. So far as the private sector hospital is concerned, the only their consultation fee is out of the reach of poor people, because as I told you that I live in central Lahore. Some of the Christian people living here, they are well to do, but most of the Christian people, they are poor, and they belong to lower middle class. So it's very hard for these people, for these reasons, to get their hand at standard medical facilities. At one place, they are not available, and on the other place, they cannot, they are out of their reach. So this is the background why they cannot have access to these standard medical facilities. So far as the solution to this problem is that primarily it's for the government to for the provision of standard medical facilities to the root level, and also if private sector hospitals, they also accommodate at least a certain number of poor and deserving people. I think this issue could be addressed to some extent.
Thank you, Dr. Shiji, for highlighting the realities faced by many and the urgent need for structured community support. With that, I have a question for Mr. Arun Kumar. Mr. Arun Kumar, can you hear me?
Yes, Yushe, I can hear you.
Mr. Arun Kumar, in your experience, have there been any movements where incorporating cultural or sensitivity helped successfully address health-related misconceptions with communities?
Yushe, first of all, thank you very much to your good self, your organization, Pakistan Health Parliament, and whole of your team, which has taken up this, major and significant issue. And I believe that it is verily ignored by the policymakers and even by those powers who matter a lot. Actually, as far as Hindu community is concerned, there is a lot of already existing challenges prevalent in that very community. अब उन challenges की हम जहाँ तक बात करें तो access to health जो है being the humble student of law, I believe that it's a fundamental right, but it's also enshrined in the Constitution of Pakistan. But as Dr. Sajil Zafar Saab said, I verily agree with him and I concede to his point of view that there are already very significant challenges in health sector which are being poised, at the very zenith of that very department. Actually, when we talk about the Hindu community in Pakistan, majority of them, live in the rural areas. If you take my example, I'm based in Lahore. I also live in central Lahore, and fortunately, luckily, and by someone's blessing, I have that very capacity in my individual capacity to take care of my health. But when it comes to the public sector, things are already very limited. Shortage is there, and when it comes to community, there is a lack of awareness, and people have that very fear that if we go to that very government hospital, there are already very existing issues. There are long queues and shortage of medicine, shortage of already a well-equipped staff. You have ever noticed that there are a lot of issues whereby uh, doctors, they वो बेसिकली जो है आपके जो डॉक्टर्स होते हैं वो कहीं ना कहीं पे किसी न किसी तरह से जो है ना उनके अपने एग्जिस्टिंग इश्यूज और डिपार्टमेंटल चैलेंजेस इतने हैं कि उसकी वजह से जो मेजॉरिटी पॉपुलेशन है उसमें आल्सो हम भी आ जाते हैं, वो भी कहीं ना कहीं पे इग्नोर हो रहे होते हैं. एंड एज फार एज जहां पर उनकी प्राइवेट प्रैक्टिस की बात है तो अगेन वही बात है कि इट्स मेजरली आउट ऑफ रीच फॉर द कॉमन पीपल. उसमें पाकिस्तान की माइनॉरिटीज दे आर आल्सो नो एक्सेप्शन. सो वन वे आर द अदर इट्स इशू, इट्स अवर नेशनल इशू. एक्सेस टू हेल्थ इज वन ऑफ अवर नेशनल इशू. और माइनॉरिटीज इस हिसाब से जो है उसमें इग्नोर्ड है कि दे ऑलरेडी लिव इन एब्जेक्ट पॉवर्टी. उस हिसाब से एम्पावर्ड नहीं है, एक्सेस टू बेसिक फैसिलिटीज से जो है महरूम है. बट व्हाट वी कैन डू, हमें जहाँ जहाँ पर उनकी एरियाज में पॉपुलेशन है, वहाँ वहाँ जहाँ जहाँ उनकी कंसंट्रेशन है, वी नीड टू रीच आउट टू देम. हमें और स्टेट इंस्टीट्यूशंस को स्पेशली इसमें अपना किरदार अदा करना चाहिए. देयर इज अ बिग गैप व्हिच इज ऑलरेडी बीइंग एग्जिस्टेंट बिटवीन द कम्युनिटी एंड द स्टेट. अब वो गैप आपकी बेसिक फैसिलिटीज देने से फिल होगा. उस बेसिक फैसिलिटीज देने के पीछे आपको एक ड्रास्टिक स्टेप्स लेने पड़ेंगे. आप लोगों को रीच आउट करना पड़ेगा क्योंकि माइनॉरिटीज के पाकिस्तान में ऑलरेडी देयर आर रैम्पेंट चैलेंजेस और उन चैलेंजेस में ये एक बहुत बड़ा इशू है.